Okay. Oh, yep. Okay. Today we're talking to somebody very special, someone I consider a good friend. Um, Dr. Sandy Roga is from the island of Aruba, and everybody is now envious. We had the great pleasure of coming down and visiting him. He showed us around with just his beautiful island, and we absolutely loved it and loved the hospitality that you offered. And we've watched you grow and change over the years. So I want to share some information about what's happened to you in chiropractic and which direction you're going and how all of this has affected it. So let's start with Dr. Sandy. When did you graduate and where did you graduate from?
I graduated in 2003 from Life University. It was during a very troublesome time at Life University. That's when they tried pretty much to get rid of SID and the accreditation from Life, but everything got resolved. So it was a very stressful time to graduate. But before graduation already, I had a job already before graduation. They wanted to put me to work right away. So as soon as I got to Aruba, I started to work. I started to work with Dr. Richard Vizier as his associate. But within 2 weeks, he left me alone with the clinic, and I was running the clinic by myself. And with no experience, not much of a clinical experience, not much business experience, but I ran the clinic really well and grew from there.
How did you get involved in chiropractic down in Aruba? I mean, was there chiropractors there?
Actually, there was two chiropractors at the time, but I didn't know them at the time. The big story is that I was playing baseball in college. I got hurt. Actually, that's the reason I never signed professional baseball. And I was constantly hurt all the way to my junior year, close to my senior year. I was hurt again. And a chiropractor comes into school to work with the football players. And he asked me, can I take a look at them? I said, of course, anything that can help. And after he adjusted me, I was like, wow, different. The next day I was able to grab a ball and throw without a pain from pain for years, and out of a sudden no pain and comfort. This got my attention, and this was a calling. This was a very, very strong calling for me. And at that point, everything became history. I started looking very hard into chiropractic. I applied to 3 schools, got accepted in all 3 of them, but decided to go to Life.
Fantastic. Well, that means you graduated with the basic old concepts of bone on nerve and correcting vertebral subluxations, find it, fix it, and forget it.
Basically, yes. But at the same time, I was lucky enough to have instructors that always made sure that to keep an open mind. And I love that from Life, because not all doctors were just a bone on nerve. Some of them really, really showed you can adjust C1 and person starts to walking, and it wasn't just bone on nerve. You can't do that. Adjust the ankle and somebody came out of the coma. So some of them kept my mind open, which I loved, and that's the reason that a lot of things changed the way they did in the future from that point on.
Now, you and I sort of ran across one another through another organization, a very good organization. That's yes. Called the Master Circle.
Yes. Dr. Bob Hoffman, the president and CEO of the Master Circle, introduced me to the brain-based concept and made sure that I was introduced to you. And this was an eye-opening, because at the point already I had a busy practice. I'm not gonna lie, I was busy at that point, but I still had many questions in my head. Why certain things were happening? What's going on? There's more to it than just that crack in that joint, and in what's happening specifically neurologically. So meeting you and meeting a group of neurologists, the chiropractic neurologists in the functional world, and opened my eyes to a different chapter in my life as a professional.
What would you say, that transition that you made to the complete neurological model of it, mm-hmm. What was it that triggered that movement in you to sort of say, wait a minute, this makes sense to me, I want to move in this direction?
One of the biggest thing is it's simple. It's actually just common sense. Because the more knowledgeable they are, sometimes knowledge can get in the way. And if you use a little bit of common sense and see the changes that you see in a neurology-based chiropractic, and then you understand why actually you're getting people well. There's no just, okay, let me adjust you and fix you and let's hope you get better. Now you know why they're getting better. And the results are much, 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 much more successful than previously.
Has there been a change in your practice and in the people when you change the concepts over to neurologically based and brain-based chiropractic?
Of course, the type of patient have changed completely. You went from neck and back problems to very sick people. You don't get just people coming in with the neck and back problems anymore. You come people with diabetes, with heart issues, with all kind of neurological deficiencies. Children, oh my God, children. We see so much children now. It's so many children. The practice has changed. The evolution is in place. And the beautiful part is you see the changes in these people also. It's not just neck and back anymore. There's still a percentage that comes in because that's what we used to be known for. But that's not what I'm actually known for anymore. Even MDs, medical doctors, pediatricians are working with us. Dentists are working with us in this neurological work. So I'm creating an alliance with other professionals at the same time. So I'm not creating enemies anymore. I sat down at a Mexican restaurant 2 weeks ago with a neurosurgeon, and we talked about these things. And these conversations never happened before because the approach is different.
That's phenomenal. That's one of the most important messages that needs to get out there to the people in the profession that seem to have a problem really grasping what I'm talking about and what we're doing with all of this. And it drives me crazy that they just want to hang on to the old. When you made that transition, what was the primary thing you had to let go of?
Actually, the primary let go was actually personal. It was the emotional attachment to that rack and cracking that we love to hear all the time, because I incorporated so many techniques to get the result that I have today based on all the neurology that we do. So I wasn't technique driven in sense of I wasn't doing just concept. I wasn't doing just motion palpation. I wasn't doing just full spine or drop. I was mix and matching, but now I know why I have to do that. The reason for it. And before in that, it was just a guesstimate and sometimes going by intuition or the best education knowledge that you know at that point to know what to do. And now it's easier. Now I know exactly which one to use and when to use it and how to use it.
I remember having conversations with you at the Master Circle, and it took you a while to finally get around to buying the NeuroInfiniti.
Yeah.
You wanted to think about it, and you looked at it. We talked about it, and I kept saying, "You're going to set that whole island on fire when you do this." And first of all, what I understand the letting go portion.
About the brain, I get excited. I'm very excited when everybody, I don't care who it is. It could be anybody. It could from the medical world. If you're talking about the brain, it's like, whoa, you get my attention. I turn around and look. So I really wanted to know more. And since I heard that this was doing all this job, I need to know about it. At first, it was a little bit impressive, too much. I brought my CAs with me. The first time it didn't work out. Then the second CA that I brought in was gold. And this is something I had to do because I had a busy practice already. So I did not have the time to just go by myself, do all the tasks, do all the reports. So bringing in a CA for me was very important to create actually what I call nowadays my healing team, my neurology team, because it's not just CAs anymore. It's a team, because if it's not a team effort, it's not gonna work either. So bringing her and my wife in to help all of us educate with the NeuroInfiniti, not only how to test it, but how to use it, how to make it productive was very important. And now it's a total different world. I'm booked up to 2 to 3 weeks. Sometimes it's kind of tough for certain patients that have to sit and wait because the lower back and neck pain patients are used to, okay, they come in now and they get an appointment tomorrow or the same day, but that can't happen anymore. It's just not happening. And bringing in an associate is always an idea that I have. I try sometimes with the politics on the island. It's not easy. There's still politics you have to go around, but that's another conversation. But now coming back to what NeuroInfiniti brought to the clinic, it's not only just patients, it's the results and the clinical results. And the person who's going to win the most is the patient. They're the winners. I'm just the deliverer. I just provide the service. And it's slowly opening minds. And in the beginning, it was hard, the transition, because I was charging this fee, and out of a sudden, I'm charging a lot more because I have this equipment. But finally, the people are starting understanding why the fee and why the equipment and why it's everything happening. I mean, I'm adjusting all the politicians on the island right now, all the big people, because they're getting better. So the word's going, and I do zero marketing. I don't do any marketing whatsoever compared to the other chiropractors on the island. So
your results are your marketing.
Exactly.
And your message is your marketing. And the message, when you change the message that has more potential, it's going to generate more income on it. Let's talk about some of those bottom line, and you don't have to tell me the exact number, but maybe let's give an idea of what has happened to your practice bottom line wise, like retention and income wise, since you've made this transition.
Well, at least the practice grew about 40%.
Holy smokes.
Yeah, and I had a bit of busy practice already, so yeah. it wasn't a season. So that right there puts it into the position where only good things can happen, and the retention is a lot bigger because the education of the patient is improving right away just by giving the report of findings of the patients and telling them what's happening with them, who they are. And they tell you, how do you know? Who told you this? I didn't tell you anything. That this is how I behave. This is what's going on in my mind. And when you create such a rapport with the patient, they will keep on coming, and they will do pretty much whatever you tell them to do. If you tell them to come in 20 times, they'll come in 20 times. You tell them 10, they'll come in 10. But you have to go with what the care plan is, and don't never abuse the patient, because before we had a cookbook on care plans, and cookbooks weren't exactly the best thing. It was more a financial thing than more based on what clinically is necessary for the patient.
Super. I do believe you're also using BrainTap in your office.
Oh, yes. It's more than that. I'm using like techniques like quantum neurology. I'm using BrainTap, and BrainTap is amazing. And I use BrainTap primarily after every adjustment. And this is the biggest window that has given us and for the biggest changes. And as I said, depression, abused people. So the stress in these people are way high. Death in family, amazing results. And people wouldn't even think that with chiropractic adjustment and using all these technologies, these things were possible in the past. So, and I'm starting to create an alliances with all the psychologists on the island, because they're sending patients and I'm sending them patients, because regardless, the job they do is also very important. So it's not just one profession. It's not just orthopedic anymore. We used to be in chiropractic. It's the general physician, it's the neurologist, it's the pediatricians, it's the psychologist. Everybody is becoming member of the group that we're working with. Dentists.
Fantastic. The question is, how long, the NeuroInfiniti is a relatively inexpensive piece of equipment. I mean, when we start talking about X-ray machines costing $50,000 and $60,000, when you're looking at less than half of that, that was an investment you made. How long did it take you to get it paid off? And what would happen to you if you didn't have the NeuroInfiniti? Like, where do you rate that NeuroInfiniti in this whole practice?
Listen, that I think I paid it before 6 months. Those 15,000 were paid before 6 months, because I ended up with a bad month. I would see for 40 new patients. That's a bad month. So if you just do the math on just doing the exams, and that's not even doing the neurofeedback, the biofeedback that comes with it. So it's just by doing exams alone, it was paid for in a very short time.
And how important is it to you in your practice now?
It is the leading factor. Almost everybody that comes in who is able to sit there for 15 minutes to do the test will do the test. Certain things that prevent me of doing it, maybe age, too young, maybe too old, or probably language could be a problem. But when that is a problem, I create other neurological testing that I can do that show them and integrate it into the system that show them that their brain is causing a problem, which is very easy. People come in with low back pain and they say, no, it's right there. No, it's in your brain. And when I show them how it works, and then they understand why it's in the brain.
And they get it, no problem.
They get it, no problem. And once they get it, it's an easy conversion to just a patient that comes in for the pain and a patient who wants a better health. Not just, they want to function better, not just being pain-free. There is a big difference between being pain-free and being healthy.
So you're also using the biofeedback and the neurofeedback as an adjunct therapy for the adjustment.
Of course. It's not just adjunct. Sometimes I use it as an adjustment.
That's what's happening.
It is used as the adjustment because I've had so many kids with anger issue coming in. And sometimes I said, I'm just going to adjust this kid once and let him do the neurofeedback and the biofeedback. And this kid is anger-free, as the parents say. I have an anger-free child, and just based on one adjustment. So I'm doing some trials based on just that also, not just comparing doing both adjustment and the feedback, but I've just done series where I just did neurofeedback on certain patients with similar results.
Wow, this is quite an incredible story, and I know that the Master Circle with both Bob Hoffman and Dennis Berman have changed over, and their whole coaching and support mechanism is neurologically based. They bring in incredible speakers like Heidi Havoc, and I know you and I have been through more than one session with Heidi and looking at one another across the room going like, yes, yes. So I want to just sort of say kudos to them because you're a product of their coaching and your commitment to the profession. And I consider you a valuable friend and a valuable co-professional in this journey that we're on. Bob and Dennis and myself are starting to get a little longer in the tooth. Sorry, Bob and Dennis, but we're starting to get a little longer in the tooth, and we have to look towards the younger generation, such as yourself, to carry this forward. It's so important that we keep this message going. And I just want to say thank you for your commitment to chiropractic and your ability to change. And I have to say that I'm looking at your picture, and at the bottom it says Janine on the bottom there. Yes. We both are very, very fortunate people. We have these ladies behind us that support us, and they're so important. I just want to salute them. And I know that you have a lot of support from her.
Yes, and actually, she's my backbone. Every decision I make, she backs me up. She helps me make those decisions also. So it's not, as I said, I created a team. I created a healing team because people call it whatever they want to do. Whatever they want to call it. I call it my healing team because without her and my team, it's not happening. So it's a very important component, not just for me personally, but as a professional.
Super. So here's the bottom line. You made the switch over to totally neurological. You were looking at it before. You paid the NeuroInfiniti instrument off within 6 months, and your practice is now 40% bigger, or income 40% in this time period. And you're seeing more people, you're seeing sick people, not just back pain people. Is that pretty much a wrap up on it?
That is the wrap up on it. And it is going to get better and bigger because I like improvement and I like change. And it is people like you, like Bob, like Heidi that bring in across the information, like George Gonzalez, and every person that deals with neurology. I love absorbing all information because it's very important in using the knowledge and allow the innate to function. And in our history, we keep on forgetting the chiropractic history. our forefathers said it all along right. They knew it, but they just couldn't figure it out yet. They,
Yeah.
they, they knew what it was, but they couldn't figure it out yet. So it is very important for a lot of chiropractors to start going back a little bit to our base and philosophy, because every time you go back, they knew about this neurology, they knew about the power of chiropractic, but they couldn't put it in numbers, they couldn't figure it out, and now we are.
Well, my friend, I thank you for your time. I know you're very busy, and I really do appreciate you taking this time on that beautiful island in the sun down there. And we'll have to get back on a cruise or fly down and stay and visit you again down there. It's a beautiful place.
And I'll be looking forward to meet you.
Super. Thanks for your time.
You're welcome.